Chapter 1, the EMS system. As an emergency medical responder, is often the first medically trained person to arrive at the scene of an emergency. Initial care is usually followed up by an EMT, AEMT, nurses, physicians, and other allied health professionals, surgeons, anything like that. Also sometimes physios and biokinetics. Some things aren't as always important. Reporting is always a very important part of this whole system. You must think of yourself as a liaison between the patient and the emergency services on a whole. Okay, reporting is important as much as getting help, transport, arranging transport, your EMS response time, things like that. The better you are doing your job, the faster the emergency medical services can get to you. On arrival, there'll either be basic life support or advanced life support, paramedics, things like that. Hopefully followed up by some hospital care, and obviously there's always somebody to ensure that things are being done properly, a medical oversight system. Upon arriving on the scene of an incident or accident, it's always important, firstly, to establish whether the patient is alive or dead, get permission to treat, and ask if he actually needs help or not. Okay, sometimes people would refuse help, but that's all part of the system of getting consent to treat a patient. However, you need to report the incident as soon as possible. Time delays could mean a difference between life and death. Your dispatch is the person that you're going to get to on the phone, you're going to speak to. He has the appropriate equipment and knowledge and know-how how to dispatch the emergency services for you. Okay, dispatch may occur by a phone, pager, radio, computer, or other means. All right, first response. Firefighters and law enforcement personnel are likely to be first on scene. Emergency medical response is a key element in providing emergency care because you are going to be the one that gets the help. EMS response and ambulance staff by EMTs, AEMTs, or paramedics is the patient's second contact with the EMS system. Remember, responder is the first one. Properly equipped vehicle and EMT staff make up the basic life support unit. Patients may receive advanced life support or ALS services from AEMTs or paramedics. Depends where you are, they're called different things. Okay, all skill levels are based on what you have learned on the EMR course. Airway maintenance, bleeding control, prevention, recognition, and treatment of shock, or as I like to put it, primary survey, secondary survey, and treat for shock. Okay, the EMS system, hospital care is department of the patient's third contact with the EMS system. Now they have all sorts of specialized units these days. Trauma centers, which is casualties with trauma centers. Spinal cord centers, people that's damage to C-spine and vertebra, basically. Hand centers for finer things, for microsurgeries, that type of thing. Cardiac centers for any life-threatening emergency to do with the heart. Stroke centers, anything helping with cerebrovascular accidents. Burn centers are very important in treating burn wounds, preventing infection, and so forth. Pediatric centers, anytime a child is involved, or an infant, baby, it's important to have the right kind of knowledge. Those people are very important in dealing with children's illnesses and things like that. Public health is important for the monitoring of restaurants, cleanliness in government places, public places, conducting immunization programs, and determining whether diseases are contagious or things like that. There's always going to be some sort of incident management system involved with that. 10 standard components of an EMS system: the regulation and policies, resource management, human resources and training, which is part of what we're doing now, transportation, equipment and systems, medical and support facilities, communication systems, public information and education, medical direction, trauma system and development, and evaluation. A lot of these type of things are all developed from military strategies. See what happens in the battlefield, and then it gets fed down into the civilian life. Transport is probably the patient's best, the speed at which the patient is going to get to medical help, definitive medical help. So good transport systems are always important when trying to get a patient to hospital. One never knows whether you need a helicopter or medevac or just a standard ambulance to get you to where you're going. If a patient is serious enough, then we would need to get them to a hospital or medical facility in the shortest possible time, especially in rural rescues and things like that, where there's long distances, rough roads, and terrain that you can't get to very well without a 4x4, then a helicopter would really, really help in the situation. Okay. When EMS personnel are unable to give the patient adequate life support system in the field, we need to get them to a medical facility very, very quickly. Okay. Training, skills and knowledge learned on the EMR course provide the foundation for your entire EMS system. What you learn here is the basics of what you learn in every single system that is available. Always refers to primary survey, secondary survey, treat for shock. Okay, skills can be divided into two main groups. Okay, trauma patients, in other words, patients that have been involved in accidents, explosions, falls, things like that. Anywhere where there's a good chance of hemorrhage, major multi-trauma, things like that. That is always a trauma center involved in that type of thing. Okay, and the other one would be sudden illnesses, unexpected serious illnesses, heart attacks, myocardial infarctions, anything to do with the heart or the vascular system, seizures, any neurological type of disorders, things like that, whether it's from normal seizures or head injuries, overdoses, things like that, problems associated with excessive heat and cold, your environmental factors, alcohol and drug abuse, poisonings, bites and stings, mental status, altered mental status, behavioral and psychological pieces, emergency childbirth. Those are basically your major categories of training, your second set of skills. Basic goals of the EMR is to teach you how to evaluate, stabilize, and treat the patients using the minimum specialized equipment. You need to learn to improvise. You need to be able to work with or without a first aid kit. Okay, because remember, you can't use something that you don't know how to use. So everything starts in your brain. So it's very important to learn as much as possible. Keep reevaluating yourself. Okay. You need to know what to do when you arrive on scene. If you find a patient that you suspect has fallen from a height or has a spinal injury or something like that, it's better to leave them in the position you find them in. You always try and make the patient as comfortable as possible, but in certain incidents, if there's no danger to the patient, we need to support them in the position we find them in. Whenever you judge a patient based on cultural, religious, color, or sexual orientation, okay, age or socioeconomic status, they deserve as much help as everybody else does. Okay, obviously you've got a responder's kit or first aid bag, whatever you've got, a trunk. Okay, we need to know how to use everything that's in there. Okay, and don't carry excessive stuff around with you because it just becomes heavy. You might have to carry it a long way, and then you're going to start throwing things away and losing things, the things you need most. The basic kit. Okay, there's always a suggestion. You can look on YouTube and places like that. Everybody has their own ideas. But if I can suggest to you maybe that you use the minimum amount of stuff that you need, okay, in a bag, keep the rest in another trunk somewhere else so that you know what you're taking with you and what you're going to need when you go to a situation. You need to learn how to improvise where there's little or no emergency medical equipment available. I always make sure I have a roll of cling wrap, a small thin roll of cling wrap, 100 mils. Can use it for bandaging, can use it for burns, can use it for anything I need to, even splinting, or use it as a tourniquet. Okay. You must also know how to assist when the EMS arrives. You might just have to stop what you're doing and help them, even if it's controlling the traffic, bystanders, or things like that. Any additional skills you can develop as you're going along will always help you. Urban emergencies are definitely very far away from a rural emergency. Farm injuries, tractor injuries, wild animals, things like that definitely don't present in ways that they would if you had an urban type of settlements. Regional things might vary as well, from mountaintops to sea level, from ice and snow to rain, wind, drought, things like that. Supplemental skills is something you may require to learn, and in order to be able to assist your local EMS system. Okay, roles and responsibilities of emergency medical responder. Obviously, it goes without reason to say that you need to be in a fairly healthy physical and mental condition, probably more so of a mental condition than a physical condition, because things can get quite hairy at times. Okay, we need to keep our equipment in a ready state. Always have your things packed, ready to roll. Okay, respond promptly and safely to a scene of an incident or accident, sudden illness. Goes without saying that your vehicle or whatever you're using to get there needs to be in a roadworthy or maintainable status at all times. Ensure that the scene is safe from hazards when we do our primary survey, secondary survey, and treat for shock. Primary survey, first thing is check for hazards. Protect yourself at all costs, otherwise you will need 2 sets of EMS people instead of just one. Okay, protect the incident and the patients from further harm. Promote seriously fast, speedy recovery, and prevent the illness or injury from getting any worse. Protect yourself at all times and try and keep the patient alive, whether you need to use CPR or whatever the case might be. Summon the appropriate assistance. We always call to get help. So the first H is hazards, second H is help. Okay, or if the patient is alive and well, get him some help. Gain access to patients, perform patient assessment, primary assessment, secondary assessment. Administer emergency care. Once you've finished with your assessments and you've established what the cause of the trauma is or the illness is, then treat the patient appropriately. Always try and provide some reassurance to the patient and family members. And as I said in the beginning, we only move patients when absolutely necessary. Remember, it might be at some stage in the game more important to move the patient. In a case of life over limb, might be coming into this type of thing. Down the places you need to move a patient, stuck in a car and the car's on fire, or a building's falling down around him, or there's floods or something like that, and we need to move the patient. It becomes a necessity to move that patient. Otherwise, we will lose them. Okay, always seek and direct bystanders' help. Necessary, control the activities of bystanders. Assist the EMTs and paramedics where necessary. Maintain a continuity of patient care until somebody arrives where you can hand over that either is a higher qualified person than you, or at least equally qualified as what you are. Remember to keep documentation. We're going to do documentation, and keep your knowledge and skills up to date. Continuous reassessment and development of skills are important. All right, documentation. It's clear, documentation be clear, concise, accurate, and in accordance with the acceptable policies of your organization. Sometimes when you're just a first aider, you are the organization. You need to keep yourself up to date, and you need to keep your records. Now, in the old days, we used to use little notebooks and draw pictures and things like that. Nowadays, I can suggest you have voice recorders on your smartphones to record your findings, if necessary, with permission from the patient. Take photographs of serious injuries and things like that, something you can forward it on to the EMS system before they arrive, so that people know what they're looking at and what they're coming into. Okay, provide a basis to evaluate quality of care given. Obviously, if you've got dressed, bandaged, splintered and things like that. Make sure that you get pictures, make sure that everything is right. Okay, documentation needs to include things like the condition of the patient when you found them, descriptions of the injuries or illness, initial and later vital signs. We always need to get a baseline set of vitals. Your first set of vitals you get: breathing, pulse, skin color, temperature, pupil response, all those kind of vital signs. Okay, treatment you give the patient, and the agency or personnel who took over the patient treatment from you, and any other helpful facts. Now, helpful facts will include things like hazardous situations, whether it's riots, storms, explosions, chemicals, electrical cables that are down, things like that. Those type of things are important for people that are approaching the scene. Vital information for them. To be a good EMR, you need to also reflect certain characteristics. Be honest, always conduct yourself in integrity. Okay, be aware of patients' feeling, have empathy towards the patients and the patient's family. Be motivated to get the job done and understand the limits of your skills and training. You're not a surgeon, you cannot operate in the field, not even if you think it is necessary to save that patient's life. Okay, always be an advocate for your patients, always have your patient's best interests at heart. Okay, have a good attitude in everything you do. You should look professional at all times. You don't look around like looking like a hippie coming from the nearest bush settlement. You want to be neat, clean, and have your equipment in hand. Quality improvement, the process of medical care systems to evaluate the effectiveness and safety of current treatments and procedures. We're always going to try and get better at what we do. Safety actions of EMRs must not cause harm to the patients, bystanders, or EMS providers. It goes without saying. Effectiveness, ready. All knowledge is based on scientific and provide desired benefit to the patient. Patient-centeredness, be responsive to the patient's physical needs as well as his or her values, religion, or heritage. Timelines, we always need to be as prompt as possible, but don't rush so that you miss things out. Do everything in a timely manner. Okay, efficiency, the more efficient you are, the better the chance the patient has of surviving. Okay, we also don't want to waste all of our supplies where it's not necessary to use things. Okay, and excessive use of equipment just wears them out, and they would need to be serviced more regularly if you're wasting time using things. Equability, care should not vary from patient to patient. Everybody should get gold standard or diamond standard or plus. Treatment, okay, it doesn't matter if they're male, female, white, black. Living at the coast, living in the areas, it doesn't matter. Geographic locations don't make a difference. People don't make a difference. We're here to love and care and treat our patients all equally. Once certified as an EMR, you must know the national, international, state standards wherever you're working, whatever you're doing. You need to also know, if you're working for a company, what the standards, operating procedures of the companies are, what their policies are, and what you may and may not do. Okay, it's your responsibility to keep your certification current, maintain your skills, and it's always a good idea to do regular refreshers.